Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What connection is there between hair loss and dermatologists?
That's a really great question. A lot of people are surprised to find out that a dermatologist is the doctor that you want to see for problems with your hair. And also with your nails because the mechanisms that grow hair and nails are actually developed in the skin itself.
What are the most common causes of hair loss?
The most common cause of hair loss is hereditary hair loss, which affects approximately 80 million men and women. There are other causes of hair loss as well, such as medications. Sometimes there can be temporary hair loss following childbirth or a stressful event. And sometimes there's causes of hair loss that can be an indication of an internal disease.
So at what point should someone with hair loss seek out a dermatologist?
Dermatologists always recommend early treatment for hair loss for the very best results. The sooner that you see a dermatologist for the problem of hair loss, the better we're going to be able to help you. It really depends on the type of hair loss in terms of the treatment that we can offer, but we can help many, many people to look and feel better with their hair loss.
Does hair loss affect men and women differently?
Men tend to have a receding hairline, and they may experience some thinning on top, whereas women typically keep their normal hairline, and the only thinning that they may notice would be a widening of their part.
Are there any preventative measures that can be taken?
It really depends on the type of hair loss, but many people are surprised when they see a dermatologist to find that some of their hair care practices may be contributing to their hair loss. For example, hair care practices that promote breaking of the hair can be experienced by patients as hair loss, when really what they're seeing in the drain or in their hairbrush is fragments of a broken hair. So in the case of chemicals, dermatologists typically recommend that patients try to space out the amount of time in between their chemical processing and dyes, and also to only undergo one chemical process at a time to allow the hair to recover in between the processes. For the heat from a hot hair dryer or a curling iron or a flat iron can actually boil the water inside the hair and make it more brittle and prone to breaking when you're brushing your hair or towel drying. So we recommend toning down the heat and avoiding heat to the hair as much as possible. And also when you're towel drying your hair, wrap the towel around your head like a turban so that it can absorb the water, and let the air dry your hair rather than using heat and aggressive rubbing.
Are there any preventative measures that can be taken?
Shampooing and conditioning it very, very rarely is the cause of hair loss, but definitely the way that you use your shampoo and conditioner can help you to look and feel better while you're managing your hair loss. So for example, dermatologists usually recommend concentrating the shampoo at the root of the hair so that you're really shampooing the scalp and not lathering up the entire hair shaft itself, which can dry the hair and make it prone to breakage. For conditioner, you reverse the process and you want to focus that on the tips of the hair where it tends to get the most dry and brittle to make it look shinier and more elastic. If you put the conditioner on the top of the head, on the scalp, it can make hair that is already thinning look limp and make the problem look worse than it is.
Are there any medications that can accelerate hair loss?
Sometimes we find that some medications, particularly some blood thinners, some blood pressure medications, and some anti-seizure medications, may contribute to hair loss, but we always recommend patients do not stop their medications until they speak with their dermatologist, who can help them and their doctor to find safe alternatives to use. There are a few points about hair loss that dermatologists like to share with people, and that is to recognize that your hair loss may be temporary and it may grow back on its own. But if you're concerned about hair loss, seek the care of a dermatologist because there are many treatments that are available today that can help you to look and feel your best.